This is Dr. Corey Maas on Looking Your Best, and I got an opportunity to answer some questions about the history of facial plastic surgery as the current president of the AFPRS and some of our great leaders that will be speaking about it at our upcoming meeting. One of the questions I get from a lot of people and patients at parties and other places, social gatherings, is how old is plastic surgery? And it actually dates back to the beginning of written and modern medicine. So the age of plastic surgery probably is most closely related to hieroglyphics that were Egyptian writings that were around 1600 BC. And in those, very detailed anatomic drawings were done, as well as treatment of medicines and infections, even with honey and moldy bread, which is penicillin. It's from a type of mold. But in those, they also described the closure of wounds with sutures, which I think probably was really the beginning of plastic surgery as we know it. So that's ancient medicine, evolved later into some flaps that were written in Hindu scripts that are quite famous and were also quite detailed. So where did the word plastic surgery come from? Well, it really comes from the ancient Greeks, about 800 BC to maybe 100 years BC. The word plastikos, which was to change form or shape. And if you could take the other derivatives of that, cosmetic, which came also from the Greek, which was kosmetik, which had to do with adorning or changing adornments of the body, or typically with jewelry or clothing. And that ultimately was adopted from the French, from cosmetique, basically the same word. And so the cosmetic and plastic surgery terms really came from, like much of all of the Western languages, came from the ancient Greeks and Romans. And it's got an interesting, phenomenally interesting history around it. So the question then is, where did plastic surgery come from? And it's interesting because there's really, I would call, two eras of what we call the development of plastic surgery. And one was the real ancient era, which we really discovered, in the 1900s, where they found these ancient scripts and even hieroglyphics and papyrus of Egypt. And in those scripts, there's in-depth discussions of using different types of flaps to reconstruct the nose, using sutures to close wounds, etc. And then as we move along, keeping in mind that really in the early development in the 1900s of medicine, there were just two fields. There was medicine and there was surgery. And the surgery part of it was really fairly early. Many did practice both in the early part of that segment. But the surgeons really developed into skilled and experts in anatomy and did their areas where the people in medicine, just like modern day, were excellent in diagnosis and treatment of diseases. And it wasn't until about the 1920s, maybe early teens even, before any surgical specialty developed. And the first of the surgical specialties was ears, nose, and throat surgery. In fact, most argue that it was eyes, ears, nose, and throat surgery. And that's where modern plastic surgery, and especially modern elective or cosmetic plastic surgery, began, with ear, nose, and throat surgery. And I'll tell you a bit more about this, but they're primarily from ear, nose, and throat doctors, who at the time included Jacques Joseph and then later Sir Harold Delph's Gillies, who were both trained in ear, nose, and throat surgery and went on to do fantastic things. Jacques Joseph, in fact, being the person that was probably first described cosmetic surgery as being a legitimate surgery for the psyche of the patient, because up until then anything cosmetic was considered heresy, ridiculous. Why would you do surgery to change and put people at risk to change their shape or form? The history of modern plastic surgery and surgery in general was described by a paper. A lot of people ask about papers or manuscripts, and the Edwin papers are often described as some of the earliest that documented really the sophistication of the ancient Egyptians, who had in this papyrus that was discovered by Smith and translated in about the 1830s, an extensive library of treatments of, fractured bones to treatment of illnesses and infections to wound management and closure. And it was really, they had a very good practice of developed medicine going until the Persian invasions. But those were ultimately adopted by the Greeks, and probably the most famous of the early Greek, Hippocrates, is still a very integral part of our practice, which is the Hippocratic Oath, which begins with, first and foremost, do no harm. So in the ancient texts that were discovered, and much has been written about these, a very important ancient teacher, Sushruta, who was an Indian physician of great renown and had teachers and disciples that had to learn and train 6 years, and had a whole method of training where they had to do dissections on vegetables and dead animals, and they had to do all these things before they treated patients. But Sushruta wrote a series of papers which ultimately functionally became chapters in a massive text which included both medicine and surgery. But because the detail that was in the surgical part of it, at least as modern historians describe him, the detail of surgery got him named the father of surgery, and ultimately the father of plastic surgery. I mean, you could obviously call him the father of a lot of types of things, even surgery, brain surgery, neurosurgery. But these texts were a tremendous compilation of knowledge that had arisen from this man who lived from 800, at least most historians estimate that he lived from 800 to 700 BC. So really alongside the Greeks, there was this developing and significant development of surgical techniques. So if we look historically then at all these ancient papers and we try to translate into modern plastic surgery, there are about 3 or 4 or 5, you could probably name a few more, names that come to mind that developed modern plastic surgery, really first with rhinoplasty, which was a truly cosmetic, changing of the face. And it's interesting that 2 surgeons from the US and 2 from Germany, that was Jacques Joseph and Dieffenbach from Germany, respectively, or Prussia, and John Rowe and Robert Weir from the US were both doing surgeries to change, cosmetic changing of the nose, and both writing papers. It turns out that the first paper published about cosmetic was by John Rowe, who was an ear, nose, and throat surgeon, as were all of these surgeons that were doing these early developments. Followed later, just a little bit later, almost concurrently, by a phenomenal, often he's called the father of modern plastic surgery, ear, nose, and throat surgeon. Then that was Sir Harold Delph Gillies, who wrote an extensive text on plastic surgery of the face. Sir Harold Delph Gillies was trained in the military, in a military hospital in France, and ultimately moved to England, where he opened a massive hospital and wrote many papers on reconstruction of war injuries from the many soldiers injured in World War I. So what were the biggest advances in plastic surgery that happened in the 20th century? And I'd like to say that it was some surgical technique that we developed that made the changes, but it was really about 2 or 3 things that I'd say that made the biggest difference. First was the discovery in the late 1800s by Lister of bacteria, and ultimately the discovery that infections were caused by bacteria and other organisms, and that aseptic or clean or sterile techniques in surgery could prevent infections. And that really developed over the first half of the 20th century quite extensively. And then with the development of antibiotics right at the end of really the beginning of World War II, when penicillin was first administered, we began to understand that antibiotics could prevent infection and treat infections. And probably on top of all those was the rapid advances in anesthesia, which originally were done with drinking wine, literally, and developed into ether being dripped into cotton, and ultimately the really sophisticated and very safe techniques of anesthesia now that allow us to do a lot of the procedures. If you put all those things together, aseptic technique, anesthesia, antibiotics. And then in the later half of the 20th century, there was the issue of the public perception changing from it being vanity that drove people, and rather it was an improvement in self-image and being and looking your best. And that became accepted as a modern standard that no one had to really fight back on. Remember, these early surgeons often weren't even offered hospital privileges where they were doing the procedures. So what were the biggest advances in the last 25 years for plastic surgery? And again, I'd like to say it was some unique and special surgical technique, which have gradually improved over the years, for sure, with little but significant advances, small advances over many, many years. But I would have to pick two products or classes now of products, Botox or the Botoxins that were really discovered or at least advanced widely around in just before the 2000s, and the cosmetic injectable filler materials, along with a host of other energy-based devices like lasers and light-based therapies. And those really have changed as adjuncts to surgery the way we think and approach patients in many ways. In the last 5 years of our history, I'd expand upon that further and say that as far as advances we've seen, it's probably the non-invasive or minimally invasive, might be a better way of saying it, procedures that we're doing with lasers and light and other energy-based therapies that can be applied to the entire body, and certainly are part of the learning and tools that we're using, along with the injections we just spoke about, that have made a lot of difference and blurred the line between someone going to, for example, an esthetician or getting a facial or their nails done or hair, and stepping into a plastic surgeon's office, because those things are non-invasive, have little downtime, and tremendous results for patients in improving their appearance. I have to add that with these advances over the last 20 years, the movement of tissues from one area of the body to another in the reconstructive side is now down to an art that's remarkable. And I mean, along the lines of face transplants, etc., has made a substantial, huge advances in reconstructive surgery of the head and neck and other areas of the body.